everyone. How are you?
Good morning.
So the one word that I haven't heard this whole time is shelters. When I speak to people who are homeless and I try to engage with them and get a sense of what they're experiencing, what people are able to tell me when I'm trying to get informed consent to talk to them is they don't feel comfortable in the shelters, which is why they're living outside of the Sbarros in Penn Station or in Port Authority. And what everyone's discussed today is the conflict with wanting to make sure New Yorkers are safe, but realizing that these are our most vulnerable residents and they need to be protected. They don't need to be in jails. So I wanted to know specifically, how does this plan interact with that? How do you ensure that people are able, once you're able to get the medical care, once you're able to get the mental health care, how do you keep this cycle from functioning properly? Because there's so many breaks at every point of the system. I see Dr. Katz, who has where all of the people are living in the psych beds. They have supportive housing. We have the shelters. People are going in and out. We're in the subways. There's so many broken points. My question is...
This is our press conference, so you just do whatever you want. I'll let you know when you're not doing well. You're doing well, so just flow. It's not theirs, it's ours. Okay.
My question specifically is, how are you ensuring that people are not going to be cycling more and more in and out of the shelters and being able to make sure that where they're going is safe and we're able to prevent the crisis that we're seeing on the subways? Thank you.
And you're right. I hear that often. People who are in congregate shelters, they feel threatened. They're often attacked. The services are not there. We want our shelter professionals who are there to also be part of the system. If they identify as someone that's there to sleep, and they identify they're dealing with real mental health crises, we need to report that and let's identify it right away so they're not in an environment that they are assaulted. And as this plan continues to evolve, we have to do a better job in making sure everyone that's in a shelter should not be in the same type of shelter. There may be some additional needs that must be carried out. And that's what Dr. Fasson talked about, how his agency that he was formerly a part of, Fulton House, identified that and did a good job at it. Dr. Fasson, you want to add anything else to that?
I think that is the central question. How do we get to a place where we've got a coherent system where these cracks start to get closed up? And this plan is the first step in that process. But make no mistake, there are issues with our housing system, our supportive housing system, getting people into supportive housing, getting them in a timely fashion. Our DHS and DSS team does a fantastic job with a very challenging situation in running our shelters. And we need much more stable community-based psychiatric care, substance use care. So this is the first step in a long-term process. Within a month, we're going to be convening experts for exactly this long-term mental health and housing roadmap conversation, because we know that this is just the front end of a large back-end problem.
On that question, we also have $25 billion in our housing program. $25 billion, an unprecedented amount of money has been posed in my first budget. We're going through the steps, working with the legislature. By the end of March, I hope and expect that we'll pass a plan that'll have $25 billion committed to over 100,000 affordable housing units, of which 10,000 will be supportive housing. That is not a short-term solution. I'm not trying to say it is, but that is, as you heard, the longer-term solution. And I do believe as the pandemic abates, the fear of going into the shelters, which need to be made much better themselves, but for the last 2 years, the thought of going into a congregate setting during a pandemic is fearful. So I understand why during these 2 years we've had fewer people doing that. So I think that's going to turn around as the numbers get better. But so it's short-term and long-term.
Courtney, can we clarify?
Because I want to go back to what you said is so important. And I'm going to take your question, and we need to look at how we're doing housing. Because if a person has severe mental health issues, then should we be just automatically placing them in any shelter? And so I'm committed to taking your question and drilling down on like how are we dealing with that person with severe mental health issues? Are we just putting them in a population where they're going to be abused? That should not be happening. I know we're expanding the safe haven beds. So we're going to take your question and we're going to dig into that because that is a question that we need to look at. And it's not a one size fits all. We need to deal with it on a case by case. And I thank you for asking that question.
Sure. Courtney.
First question is for the mayor. The second question is for the governor. First question is to the mayor. Going off of the safe haven beds, your plan says that you're going to add about 500 or so safe haven stabilization beds. Are those actually new beds? This is the amount of beds that was potentially already going to be added. And how do you ensure that there will actually be resources for people to sleep in, considering they may just want to go up and sleep on the street? And then for the governor on the psychiatric beds, you talked about more money for psychiatric beds. Are those private psychiatric beds or actually state facility psychiatric beds? In addition, the Cuomo administration, before you, there's been a long trend of not investing in psychiatric beds. Psychiatric beds in institutions have been going down for many, many, many years. Does the state not have some responsibility here for not investing in these state psychiatric facilities?
You can always tell how severe a problem is by the length of the questions that comes from reporters. So it's obvious that we all realize that this is a crisis. We all feel this way, and we know it has been inhumane. You want to talk about the new beds, the safe haven beds?
Thank you, Mr. Mayor. Gary Jenkins, Commissioner for Department of Social Services. To your question, Courtney, yes, these are 500 new beds that we're adding to the system. And yeah.
Question for Governor Humphrey.
Your half of the question, they're Article 28 community-based beds. And one of the reasons why there are not beds available now that I believe can come online very soon is that we've had adjustments made during the pandemic. We had a staffing shortage of every level of healthcare worker, as well as the reimbursements have been wildly unsatisfactory in my judgment. That's why my administration, and it is a new day in how we handle these issues, we are increasing the state's share to those facilities by at least 10%, and the federal government will match that. So the gap that exists right now between what they're reimbursed for a psychiatric bed versus a non-psychiatric bed doesn't make it attractive for the hospitals to accept more beds, as well as the staffing crisis that I mentioned earlier. Almost $10 million we're putting toward the recruitment and retention of people who will service those beds, the higher skill level of psychiatric nurses and psychiatrists. So that's what the plan is. Dr. Anne Marie Sullivan, who is managing this, is happy to answer any other more in-depth questions on that.
Fabian. Dr. Bassan wanted to add something.
I just wanted to add one point, and just to reemphasize the interconnectedness of this issue. This all stems, in part, this artificial constraint in our psychiatric beds from a federal policy that dates all the way back to the Social Security Act of 1965, the IMD exclusion, right? That basically says if you have more than 16 beds in an institution, we will not reimburse you for inpatient psychiatric care. That's an artificial constraint that gives no incentive for health systems to expand access to this care. And Dr. Sullivan's an expert in this, and so she can add more if there's more to add. But we have to work with our federal partners as well.
So it's not state psychiatric facilities?
No, it is not state psychiatric beds. It's the community-based beds, the Article 28 system in all the hospitals, the emergency rooms where people go. Those beds have been closed due to COVID, and reopening those will be a big boon to having beds available across the state and especially in the city.
Dana.
Governor Hochul, you mentioned that there
Sure.
was...
Dana.
There were two police officers at the end of the platform when Michelle Go was pushed onto the track. Can you hear me?
No, say it again.
There were two police officers on the platform when Michelle Go was pushed to the track.
Yes.
And, the announcement today that the police are going to have to enforce code of conduct suggests that they weren't doing so in the first place. So how much of this is just a public call to the police officers to do their job?
I think you said there were 2 police officers. Okay. And how much is it, have the police officers doing their jobs?
I can say, so there were 2 police officers
Yes.
at the end of the platform when
Yes.
Michelle Go was pushed to her death. And this announcement that the NYPD will begin enforcing MTA Code of Conduct suggests they weren't doing so in the first place. So how much of this announcement is a public a task that they do their jobs?
First of all, I like your question because here's what we have been doing, Dana. We've been sending mixed signals. I mean, we tell police officers to do their jobs. They do their jobs. Someone jumps the turnstile. And we say, you know what? We're not going to enforce that. Police officer goes and say you cannot live on the subway system. Then all of a sudden, someone walks around with a camera and say, look what he's doing, taking someone off the subway system. So we're telling the officers, we want you to do your job, and then when they do their jobs, we criticize them and attack them from doing so. So what I'm saying today to the men and women who are on the subway system, like I was, I got your backs. Do your jobs. This is what you're supposed to do. And we're not going to allow the naysayers to tell you because you're doing your job that all of a sudden you're going to become under scrutiny and sometimes being hit with departmental charges. That is not happening. You do your job in a respectful way that you're supposed to do it, like I did it, then we are going to make sure they get the support that they need. When I did it and I ejected people that was disruptive, I didn't have iPhone follow me around. And so these officers are now going to be told, because of my chief, they're going to be told, you can do your job. That is music to the ears of the officers that want to keep our system safe. You want to ask something, Chief?
Sorry.
You feel free, got all the stars
So I'm just going to, good morning, I'm just going to, a few points in reference to your question. Just, we are thankful and we know that the mayor and our police commissioner and our governor do have the backs of our officers that are in the Transit Bureau and the additional officers that come in every day from patrol to enhance our patrol coverage. So rules of conduct is something that every transit cop is aware of and knows the rules and does enforce the rules. So year to date, our arrests are up 45% in the Transit Bureau. Our tab summonses are up 20%. We've written 10,000 tab summonses for infractions. So we do enforce the rules of conduct. We do work hard to maintain order. And we will continue to do so. And I am thankful that, we have the support of the administration in that endeavor. What we're talking about with the homeless initiative is slightly different. And I just want to, we are a dedicated stakeholder in this new homeless plan. Our officers encounter the homeless every day in the system. And our officers are going to physically ride the trains with these teams. We're going to support them. We're going to be at the end stations to help them when they take people off the train to get them the services they need. The message I'm sending to my officers in transit on patrol as we engage in this is to treat the homeless with patience, with compassion, and as a dedicated stakeholder in this team, we're going to work hard to diminish the sense of nobodiness that the homeless often feel. We're going to engage them in a way that makes them feel like they are what they are, a significant member of our population and a significant New Yorker. So we're dedicated to that, and we're very happy to be part of this initiative. And one other aspect I just really want to talk about, we're not just going to create a small cadre of officers dedicated to this safety plan. Quite the opposite. All 2,400 members of the Transit Bureau, from myself on down to the members on patrol on the trains right now to walking the platforms right now, are partners in this plan, and we are determined to make it successful.
Sorry, 2 questions. The first for Shams. And we talk about the homeless a lot and talk about how sometimes folks who are street homeless don't want to move inside. Can you tell us about that? And then secondly, for the mayor or for the chief, transit recidivists are supposed to be banned from the subway as of 2020. Has that been happening? Do you know if people who've been committing crimes have been banned from the subway?
Yeah. So for the question for me, obviously the fact that I'm even here should send a good message to everybody. I've been working with the transition team to begin with, and also with the new administration, just to basically formulate ideas based on my lived experience. And I'm always in the streets, always out there. I'm talking to people because now I'm housed, so people have different situations. But what I know from my own experience being raising my son in the shelter system, the family shelter system, and being in the single adult shelter system for about 4 or 5 years, mostly being congregate shelters, those places are definitely dangerous places as they stand, most of them. And so if you're listening to what the plan is saying, basically, is there's going to be an increase in the type of shelter that I know from personal experience, and also I've been helping a lot of people get in these places that are on the streets, are on the trains. These are the safe havens, low barrier shelters, and stabilization beds. These places are options that I'm seeing that many of my friends who will not enter a congregate shelter, they're interested in going in those places. So obviously for me, the investment into more safe haven, more stabilization beds, and other type of dwellings, and the reimagining of the congregate shelter system is where I believe the administration is going. And we just, like the mayor said, we need the time and the resources with the state funds and stuff is coming. We just need the time to let that happen, because it's not going to happen overnight. But I'm definitely confident in my own experience that the people that are on the streets and in the trains, my brothers and sisters, those people will leave if they're given a better option. They don't want to be there. They may not want to go in a congregate shelter, but they don't want to be there. And we just got to give them a better alternative. And I think that this administration and the state is committed to that. And that's one of the reasons why I'm here.
So I just want to clarify something to your question. There are certain issues that could be an aggravating factor that might identify somebody who's a recidivist in the transit system, but they are not banned from the transit system.
Well, and we would sit down and we would factor that out, but I am not a supporter. You're pushing the problem to the streets, and you create a negative encounter with those who may be recidivists for fare evasion. And if you're saying you no longer could use the system, then how do they get to the places they could have? They're low-income New Yorkers, so we're going to look at that, but we're going to make sure the rules are enforced. I think that is at the heart of the issue.
Mike?
No.
I would just add to the mayor's point, the MTA is not asking for criminalization. We're just asking for consistent enforcement that will, protect, the riders and create a more an environment of order rather than disorder. And that's what the mayor and the police team have been very clear that they're promising.
Good morning, Mr. Mayor.
I'm sorry, hold on. Don't forget Marcia. Okay. You're quite welcome, Marcia. Not really, but because you got some trick question you're about to ask.
I mean, this year up until now, we've seen 6 people die in the subways. Last year, that number was 2 people. And you mentioned Kendricks law. You've got a lot of beds lined up. It sounds like you and the governor. But if people don't want to accept that help, can you talk about what's going to be in place to say, well, you have to take that help? And if it's not in place, how do you expect that number of, these deaths we're seeing on the subways to change?
And when you look at many of those deaths, it involved those with mental health illnesses. We look at the Miss Gold's case, and some of the others. And so that's what Sham was talking about, is that we really have to do a deep dive into where we placing those who are dealing with mental health crises. And that goes back to the question that was asked, that I'm going to sit back down with Dr. Fassan, who has been amazing at doing this, and say, we can't have a one-size-fits-all system. And as Sham indicated, many people who are dealing with those mental health issues are saying, we will go to a place that is uniquely fit, a unique fit to the issues we are facing. And that is what we have to do. And so this is an evolving plan. We got to get it right. But what we're not going to do is to ignore the things that's feeding this crisis, going back to the federal laws that are broken, going back to what we're doing here, going back to the shelters. This is a dysfunctional system, and we have basically ignored it. And many people have stated to me after the primary, Eric, you're never going to be able to fix this, so why even try? Just hold on and let the process go. And I say no to that.
Mr. Mayor, thank you for taking my question.
Very well, Marshall.
I was wondering how you think the approach to the people on the subways and in the streets as well will change so that you can convince them to get help. Because I'm wondering if you can force them to get help, and if there's a way to determine if someone is an obvious EDP, that you can force them to get help, either to go into the mental health beds or to go into a shelter, because otherwise they're going to be back on the subway and they're going to be back on the streets.
One of the question is, how do you force people to get the help? Yeah, to get the help that you. But I'm gonna let Dr. Katz respond. But this is what the problem has been, based on my observation, that we have become enablers to those who need help. What do I mean by that? Why are there so many tents under bridges and sidewalks, on the streets? Why is someone living under the stairs? Why we look and know this person is dealing with a mental health issue, yet we allow them to just do so in places that they shouldn't. We can't stop people from sleeping on the street. We need to re-examine that, in my opinion, and that is something that we need to get support from in Albany. But what we can say, send a strong message that you cannot place tents, you cannot do things that is considered to be inappropriate, those things that are inappropriate. And so there are things we could do so that we don't enable this condition, that is within our rights and laws that we don't do.
Albany, so that we can get the street homeless off the streets.
Yes.
You want me to do it? And I'm going to do it with my partner here. So a lot of our discussion is that we believe that there is room within existing law, that it's about implementing the existing laws, that we don't necessarily have to change them, but we have to set a standard that is clear, that people who are living on the subway, who have no home, who have no way to feed themselves, no way to clothe themselves, that those people are in danger to themselves, right? That it's a pressing, imminent danger to themselves, and that we believe that by, through the state's good work, through Dr. Sullivan's good work of establishing a standard of care, we can do much better about making sure that those people are cared for. Did I say it right?
He said it perfectly. He said it perfectly. Governor Hochul earlier mentioned that we will be issuing guidance to all the emergency rooms and to the hospitals, so that when individuals come in, the physicians there who decide whether or not someone needs hospitalization will have a new guidance as to how to look at the issue. We have commitment laws in New York State. They are good commitment laws, and they do allow for severe neglect, a very small percentage of people, always keeping in mind the civil rights of individuals who are mentally ill. But for that small percentage, there is room within the laws, and there's case law to support it. So we're going to be doing guidance throughout the city and helping the physicians who make these decisions to understand better how to help individuals, that very small percentage to get the help that they need.
enforced the way you'd like to see them enforced?
Well, it's not an enforcement, it's a bit of an interpretation. It's the way you look at the laws. And I think that you can interpret some of these laws with a little more room, and there's case law to support that. And we're going to be working on that with all the facilities.
Currently, my understanding is that two physicians need to conclude that a person is an immediate or imminent danger to themselves or others before they can be held for an extended period of time. Kathy Hochul seemed to just suggest that that standard might be changed to involve other people's observations of their behavior. That's like a pretty, there are concerns also against that about violating people's rights. So how do you, it would have to be, the standard would have to be. Isn't that the case in the law?
Let me just say that there's various commitment standards, and I won't go into all of them, but the one you mentioned, which is the 2PC, allows for individuals at risk of substantial harm. It does not have to be imminent harm. And that it's how you define substantial harm when you're working with someone. And I think, again, you always have to be aware of the civil rights of individuals, but sometimes someone's neglect, self-neglect, is so severe that it would fall into that substantial harm category. And if two physicians felt that, then they could be retained for a while in a hospital with the right to go to court very quickly to find out whether or not they should remain.
Unfortunately, Governor Hochul left. But are you familiar with what she was getting at earlier about what some observers of a person's behavior, what role they might play in this process? She said something about it'll be about other people, how they observe the behavior of a person.
I think what she was getting at is that basically it's the way you look at both what someone is coming in with at the moment, but also their history. And that you really have to take into account the history that's brought forth from, for example, the homeless outreach teams and others, when you're making some of these very, very tough decisions. So I think what she's talking about is getting the full picture, and then that informs the decision made about whether or not Kendra's law is needed or at times involuntary commitment.
I think to just validate what the doctor's saying, because we run the largest mental health system, that I think it will make a huge difference if the state puts out regulations, because there's a lot of interpretation. There's a lot of individual decisions, this doesn't meet the eminence danger standard. But having the expert, the state, who is the chief regulator, say, yes, under these circumstances it does, will make a huge difference.
Legislative approval?
No, that part does not.
No, it does not, because it's not expanding the current law.
We're going to do, who you want to speak with? Who?
You or whoever is best.
Okay.
Thank you, Mayor.
Then we're going to go off.
Just wondered if you could put, we heard some numbers from the state for the dollar amount that some of these initiatives are going to be. Could you give us a dollar figure for what the city investment is in this, the top line number? And can we get some clarity on what the total number of police officers, new police officers, or deployment in the subway is going to be, and what is that? What was the baseline, and what is it going to? If I'm understanding.
Okay, so we'll get to the exact dollar amounts. Fabian will make sure you get that. Second, the number of police officers. It's not about increasing the number of officers, as I stated. It's about deployment of officers. We need to properly deploy our officers. You can't have 8 officers standing by the train booth. We have to deploy the resources that we have. That is why I have a lot of encouragement in what the chief is going to do. And then we can do an assessment that if we have to have additional officers, those who we're getting off desk duties, to be part of our enforcement. But right now, we need to deploy our officers correctly.
Number deployed in the subway on a
Was it
daily
20?
basis?
How many, Chief?
So what we have assigned to the Transit Bureau, my police officer, are about 2,000, a little over 2,000, 2019. But, we turn out about, on a daily average, over probably 1,200 officers on patrol. But what's really important to note is the supplemental coverage that we're getting from both enhanced patrol coverages from also the vertical patrols, we call them 75T for transit, that patrol service bureau officers from precincts are coming into the system they put it over the radio, they go down to the platform, they look around to make sure everything's good. We're talking about it's 5,000, almost 900 so far since the inception of this year throughout the system from patrol coverages. Top that off with an additional 60,000 station house inspections from various transit patrol officers that are on top of what's already stationed inside while they're on the train or the platform. So, I mean, the three words that I've expressed from day one to my transit officers that I'm looking for them to do is uniformed, trained patrols, to be out there, to be visible, to move around, to go on the platforms. We need to be seen. People need to feel safe. And I know, and I've heard this from many people, that when they see a transit cop, their very presence makes them feel safer. And that's exactly what we're committed to doing.
A perfect example of that was when Christina was murdered. A transit officer, a patrol officer, was in this train station doing this inspection. And he saw the gentleman there. And he says, "What are you doing here?" He did the right to inquire. He was just hanging out, loitering. And he had he told that person, "You cannot stand here and do that." Those types of inquiries allow us to identify who potentially would commit a crime and help us identify. Those are the types of inquiries that we need. We're going to do off topic, so you guys can